We're Skin Possible,
and we're senior nursing students from Empson.
And we're here to teach the U of A population about skin cancer prevention.
Our targeted population is U of A students.
And our crew is, I'm Bailey Moeller,
I'm Brianna Futrell,
Dominique Gertolacci,
Jessica Waymeyer,
Kelsey Brown.
Can you tell me what you know about skin cancer?
Well, it's not good for you, and it can be removed sometimes. Right?
It can, yeah.
Okay.
My grandpa had colon cancer, and they said they think that the two, like in the 60s, the multiple myeloma caused his colon cancer. And then my mom also had a benign, what's it called? Basal cell on her ear, and she had to get that removed.
Well, no. I mean, obviously, if you're young, you have something really bad wrong with you, but...
Just in a tanning bed or tanning period?
Both.
In the summer all the time, but in a tanning bed probably only on occasion and 2 to 3 week period times.
I tan a lot during the summer.
How often would you say you spend time in the sun?
Pretty often, especially in the summer. I drive a forklift at work, and the dock is not covered, so we get the sun beat down on us pretty good. Maybe driving.
Okay, so...
I'll ride the windows down, put my arm out the window. So.
No, doesn't the sun have to be out?
How do you feel about like the sun when it's cloudy, or, I mean, does the sun
I don't see it when it's cloudy.
So you don't put anything on when it's
No.
cloudy? Do you put sunscreen on at all?
Usually like the first time I go out, and that's about it.
And then you don't like reapply or anything?
No.
You only do it when it's sunny out, or sometimes when it's dark or cloudy?
Sunscreen only in the sun.
Sunscreen on the sun?
Well, I don't tan that often, so not at all.
Try to on my face, like a 30, but mostly an oil of like a 4 to an 8 sunproof.
Do you use any face lotion that has SPF in it?
I think Neutrogena has a little bit in it, but I don't look at that when I buy face lotion.
Nope, not at a grandma, so.
So here we have the ABCDE of skin cancers, and what it is for people to learn how to check themselves so they know if they have something that they're going to need to go to the doctor and have them look at. So the first thing you want to look at is asymmetry. If they aren't the same on both sides, then that's an indicator that you need to go and get it checked out. Another thing is borders. So you want to know if they're regular or irregular. For this one, how it's a nice round and circular shape, it would have an even border. One like this, do you feel like it has an even border?
No,
And how do you know that?
because it's all different around the edges.
Color also, it's good for a mold to be the same color. You don't want them to have any black in them. Skin cancer can also be white or blue. So this picture, again, would you feel like this is the same color or different colors? Different colors. So would you have that one looked at?
Yes.
Another one is diameter. The bigger it is, the more words you want to be about. So which one of these would you have the doctor look at?
Top one.
Top one. And another thing is if skin cancer is evolving. So if you had one that was just the size of a pencil stick, and then all of a sudden it started growing to a pencil eraser, would you feel like that would need to be checked out, or?
Yes.
Based on your answers, it's important that you use sunscreen all the time. Just because the sun's not out doesn't mean UV rays aren't being projected.
I use SPF 30 when I use it, but that's
Well, that's
rare.
good. That's like the minimum amount that needs to be in your sunscreen. So anything with SPF 30 or above is really good.
When you're applying your sunscreen, you want to make sure you have an SPF of at least 30. Ages 25 to 29 are the population that are most susceptible to receiving skin cancer. So you're at that point where you have to be most careful so that you don't develop it later in life.
Okay, so this is kind of like an effect of what will happen, like when you said driving, because your left side is exposed to the sun and your window's down, your arm might be out, so that whole side is at an increased risk for skin cancer. So some things you could do are you could just put on facial sunscreen before work, you could put on chapstick that has sunscreen in it to protect your face and lips, you could wear a hat to work, Keep your sunglasses on.
Spray tanning is probably your best option, although it can be expensive. If you don't want to pay that much for a spray tan, there's tan towels and there's tanning lotion at Walmart you can get.
Take a vitamin D supplement. You can find that at your local pharmacy or in fortified foods such as yogurt or egg yolks, orange juice, dry cereals. So it's important you get an adequate intake of that.
So here we have this little goodie bag for you, and there's a lot of stuff in it, but the one thing that I want to show you is a door handle that you can take home, and this will always be able to, you can always reference this for your moles. And it has everything that I taught you, the ABCDEs of skin cancer, and it has these punch outs, so each year or each month you can have your check. You can check yourself, and it is recommended that you go see dermatologists every year just in case, even if you don't think you have any moles. And then the back side is just showing you how you can check yourself.
Cool, thanks.
And this is yours.
Do you have any questions?
No, this was really informative. Thank you.
Was this information helpful?
Yes, I mean, I guess I was aware that my mom had the skin cancer on her ear and my grandpa had it, but I guess just realizing that family history means more to me, and like you pointing it out to me, it's not that hard to do a spray tan, save the money, put on the lotion, whatever, avoid a tanning bed.
You feel more knowledgeable
Definitely.
about skin cancer?
I'm gonna put this face lotion, skin stuff on the left side of my face so it doesn't look like that. when I'm
That's
driving.
good. It's good. You should do it right now.
Okay.
Okay.
Thanks for hanging out with us today. Skin Possible appreciates it. We hoped you learned a lot.